Hello, this is Dr. Linda Plummer Ward with the Health Ministry of Lake Providence Missionary Baptist Church. This is the first in a series of videos from the Lake Providence Health Ministry to provide CDC updates and dispel some of the myths regarding COVID-19. Much of what is shared on the internet and in social media has more myth than fact because there's no scientific basis. We pray that this information from reliable sources listed below is helpful for you. We welcome the opportunity to clarify questions as best we can. So who's at risk? Those at risk of severe disease are people with high blood pressure, who are overweight, diabetic, or who have heart or lung disease. The risk is greater in people who are age 65 and older, and men tend to get the disease more often than women and a more severe form of COVID-19. People who are confined in nursing homes and prisons are also at greater risk. There are other chronic medical factors, such as people who are immunocompromised due to cancer treatment, people who have had organ transplantation, who have HIV, AIDS, and people who are on steroids or other medicines that weaken the immune system. A chronic disease usually requires daily medications to control it. So if a person is prescribed daily medications because they were diagnosed with an illness, whether they take the medicines or not, their risk is greater, and that's regardless of their age. Other examples of chronic diseases are chronic kidney disease, especially if they're on dialysis, asthma, emphysema or COPD, and people with liver disease. In general, children and youth have the milder form of coronavirus. However, while it is not as common, severe disease can be seen in children, youth, and young adults. In most areas where COVID-19 is widespread, African Americans are shown to contract the virus and die at a higher rate than other races, except maybe Latinos and refugees. This is not simply because we're ignoring the pandemic, nor is it simply because we don't take care of ourselves. There are other very well-known specific issues in the United States that contribute to this. They are called health disparities. Here are a few. Many African Americans continue to work because they are the unseen and unsung essential workers. These include fast food workers, cashiers, stockers, janitors, garbage collectors, bus drivers, postal workers, food deliverers, and so on. We are familiar with healthcare providers, but someone has to register the patients, help them with placement when discharged, clean their rooms, prepare the food, and perform maintenance in the hospital. These workers and their families are all exposed by virtue of being at work. African Americans may be unable to adequately do physical distancing or quarantine when sick relatives are in their homes. They may have no insurance or may not be able to afford to get medical care. So medical care is often delayed until they are sicker, and therefore their outcomes are worse. African Americans are also more likely to have chronic diseases we've already discussed. There may be limited access to health care due to location and transportation. Hospitals and pharmacies are usually not in their neighborhoods, so prescriptions may not be only too expensive, but they may be hard to get filled as well. Typically, there's also limited access to stores with healthy food options and places to exercise. Now, we're still in the early stages of COVID-19. So in the past, pandemics have lasted for a year or so. While some of us have fewer choices than others to control our exposure to the virus, it's up to each of us to do our part to make choices that keep all of us safe and healthy. I encourage you to read and listen to reliable sources. Seek answers from reputable sources. Beware of sources that have no scientific basis. We're not obligated to go places that have reopened but may not be safe because of a mandate to reopen from government leaders. So please be safe, be healthy, and stay prayed up. Thank you.